I asked Dr. Ralph May to come in and talk with us this morning because I came across this study and I thought it was kind of distressing to read these numbers. Dr. May, good morning.
Good morning, Todd. Thanks for having me.
It's good to have you, the Community Guidance Center. This is right up your alley here. It was an item that came from a polling company. Why people don't go to therapy.
Right.
What prevents people from trying therapy? And there were 5 responses.
Mm-hmm.
And I'm going to throw these out at you, all 5 of them, and then just ask you to, you can take them one at a time. You can take them however you wish. I don't do therapy because I don't have time. I don't do therapy because my problems aren't serious enough.
Right.
I don't do it because I'm just too embarrassed. I don't know how to find a therapist. I don't want anyone to find out I'm in therapy. Those are the reasons, the top reasons that prevent people from trying therapy.
The time issue, that's such a common thing I hear anymore is we're so busy, we have so much going on, there's so much to do that we don't have time to take care of ourselves. It's not just about therapy, it's about eating right, exercising right, getting enough time with your family, getting off social media. People are so inundated by stuff and things that, taking care of yourself and time to really clear your head is put on the back burner in so many ways. So it does not surprise me that that would be one of the key items that people would not want to use therapy. Now, that some of the other items are more time tested. Stigma, fear of going to a therapist, embarrassment, shame. It's a sign of weakness. I'm afraid somebody's going to find out. I'm afraid people are going to think I'm crazy. I'm afraid, all these fears and concerns. I've been in the business, I can't believe it, Todd, 41 years I started. And that's always been the issue. People have always been very, it's a little better now than it was, but not a lot better, not as better as it should be. People are just afraid that, they're going to be seen as weak or crazy for seeking therapy. That concept is just, the brain is an organ of the body. I've said that a million times here, and we need to treat our brains like we would treat our hearts and our kidneys and our lungs. They're part of our bodies that need tended to. And when we don't tend to that, we end up developing complications and difficulties. And there's a lot of misconceptions about therapy. And I think the study kind of talked about that people think therapy is you go lie on a couch. And you talk about your childhood, and you look at how therapy is portrayed in the media. And a lot of times, there was just a commercial on recently where the lady was taking notes while somebody was, it was kind of a comedy commercial, I think, for an insurance company. And the guy was talking, the lady's taking notes, making comments. That's not therapy anymore. I mean, that's psychoanalysis. That's been gone for 50 years. There's still some psychoanalysis, but it's not. Therapy is you sit down with a therapist who's trained in how to listen. They're trained in models of behavior and thinking, and they're trained to listen and respect you and keep everything confidential and help you sort out, clear your head of what is in it so that you can sort out your thought process and sort of look differently at things and kind of reduce your stress. I'm telling you right now that a lot of the issues is, and I was looking at some of the data on people who use therapy, and believe it or not, there are more people using therapy than there were. About half the people who have mental health concerns are now engaged in therapy, and that's up from like a third. So we're making some progress. Yeah. But you know who's less likely to use therapy? And this is interesting. Younger people.
Okay.
Younger people are less likely to use therapy than middle-aged people. Not that they're using a bunch of it, but younger people seem to be more going into social media and,
I was going to ask.
And they're like talking to their friends, and everybody says, well, this is that, and somehow that becomes the answer. And they're not getting any type of professional support or consultation. People can't decide what's real and what's not, what's truth and what's not. It's getting kind of blurry. So this whole concept that I can talk to my friends and get on social media and answer this question is really part of the issue.
If your therapist is Twitter, that's probably not a good thing.
Twitter's not a good thing. I mean, I'm not an anti-social media guy. I mean, I use the internet, email and texting, but I kind of stay off of social media because you just get inundated with stuff and it clouds your thinking.
When people are, and I know this is not the right way to put it, but when people are looking for excuses not to go to therapy, not to start therapy, how much of that is also influenced by the fact that that's usually when they're at their most vulnerable,
right,
in terms of emotions or mental?
Right. People, when they're vulnerable, are afraid. They're just more afraid. And because they're more afraid, they don't know how to reach out or where to reach out. I think part of the issue is I wouldn't know how to find a therapist. Well, that's kind of a simpler answer, because if you go to the internet and you go to the SAMHSA website or the National Institute of Mental Health website, they have listings of clinicians available in your area. If you have insurance and you call your insurance company, they will say, here's counselors and therapists that are in your network. You can call the Community Guidance Center, and we have a central intake that will help you figure out where to, not just us, but if you need to find a therapist that's in your network, we will help you. So there's plenty of options to find therapists. Now, I want to also point out that this wasn't talked about in the study, but therapists involve a really good relationship with a therapist is a trusting relationship, a professional relationship. Finding the right therapist sometimes takes some time, like finding the right doctor. Mm-hmm. Sometimes you go to find a doctor in your network. Well, there's not a lot of connection. It may be a good doctor, but we just don't hit it off. You need to find a doctor that you feel like understands you, that gets you, that listens. Same way with therapists. Sometimes you have to look around a little bit until you find the right chemistry, because the chemistry is really important as part of the process of recovery and healing.
One of the items on what prevents people from trying therapy, I think, plays into a second part of the whole study. It is, my problems aren't serious enough. And then later down you read why people wish they attended therapy. Mm-hmm. Grieving the loss of a loved one is number one. General depression, financial struggles, a breakup, traumatic experiences, caring for somebody with an illness, the stresses of that. All of those reasons people wish they attended therapy, and yet my problems aren't serious enough.
Yeah, and that's the way we kind of self-evaluate. We minimize. Like, it's really not... There's two directions you can go. One is to catastrophize. Everything's really terrible. But we're talking about most people. Most people are like, well, I'm going to ignore this. It's really not that bad. My problems aren't as bad as somebody else. I'm going to just push through. I'm just going to deal with it. And there's nothing wrong with having self-determination and a desire to work through things. But when we isolate ourselves, when we pull our emotions inside and we just kind of tough it out, we're really putting wear and tear on our brains and bodies in ways that's very, very complex. We're talking about the brain, depression, and anxiety, but the truth of the matter is the more you do that, the harder it is on your body, because the stress hormones that build up, the wear and tear on your body are hard on your cardiovascular system. They're hard on your body in general, your musculoskeletal system, tension, stress. A lot of the more chronic illnesses in our society, like hypertension, heart disease, diabetes, are brought about by not taking care of yourself, by your body taking like a lot of stress on over time and not having a way to diffuse it.
Talk a little bit about the relationship between people who try to medicate with opioids and street drugs instead of a more traditional or maybe a more effective treatment such as therapy.
Well, there's of course a biological component to addiction, which we know, but oftentimes the use of the substance, whether it's alcohol, heroin, methamphetamine problems increasing as well, and now that the opioid crisis is starting to stabilize a little bit, people are trying to numb themselves. They're trying to shut the emotions off. They're suffering. They're struggling. I just need to escape this. Escape is the thing that people want to do. I want relief. I want relief now. I want to escape. And so the substances provide sort of an immediate break from the short-term anxiety, depression, and suffering, but it heaps more suffering onto the pile over the long run. So you're chasing your suffering, trying to suppress it, numb it, and you can't. And finally, there's not enough substances in the universe to do it.
That short-term, long-term thing that you're just talking about, I think when we looked at some of those reasons that people wish they attended therapy, a lot of those are things that we say, well, it's bothered my equilibrium. It's knocked me off balance for a little bit, and things will get back to normal in the normal course of time. But if it's not handled properly in the short term, am I correct in saying that then it becomes a long term and a much deeper project or problem?
Because you start, it's erosion after a while. This thing will be all right. Well, the next thing will be all right. Well, one more thing will be okay. I'll just keep. So you get caught in the treadmill of trying to catch up, and you never catch up, and you start getting worn down. And then you keep telling yourself, well, it'll be fine, and it's not fine, and then you're digging yourself a deeper hole. And that's, I think, where depression creeps in, where I can't do anything anymore. I'm hopeless. I'm helpless. I'm overwhelmed. There's no chance for me. There's no hope. And then, of course, my thing. When somebody gets dug in like that and they don't feel like there's a way out, suicide risk increases. And that's the thing that, we've got to be very, very careful.
So we're talking today with Dr. Ralph May, the Community Guidance Center here in Indiana, and we're talking about reasons people avoid having therapy. Let's turn it around. Who's the person that needs to come see you? Who's the person who needs to enter into therapy?
a person needs therapy when they're struggling. And I know that's kind of a vague statement, but the concept that I can't seem to get a handle on this. I just feel like I'm not getting there. And I'm talking to some people, but it doesn't seem to be helping. Generally, the rule for us, Todd, is if something persists for two consecutive weeks, pretty much every day, where you just feel like you're down, depressed, anxious, can't escape it. It's like it starts interfering with your sleep. It starts interfering with your functioning. It starts creating more problems for you, and you feel like you can't dig your way out of it. As soon as you start noticing that, that's a time to call. That's a time to call and talk to us, because we want to catch that before it progresses any further.
There's no such thing as a typical session, I'm sure, but what can somebody who's never been to therapy expect when they walk through that door?
Well, the first thing a good therapist is going to do is they're going to talk to you. They're going to assess you. They're going to find out what's been going on in your life, what your symptoms are like. Is this depression? Is this anxiety? Does it meet a clinical diagnosis level? That kind of thing. So the first visit with the therapist is kind of let's talk a little bit about who you are, what your symptoms are, and figure out what we need to do to approach this. Do you even need therapy? Or do you need a referral for a psychiatrist or a physician? Your medication might be important, because if your symptoms are really bad, medication and therapy together, the research says, is the best combination. So the first visit is an assessment. It's kind of a discussion assessment. And it's also assessment, I think, I would say for the person seeking therapy, you're making an assessment. You're making an assessment of the therapist. Is this therapist seem to be empathic and sensitive and listening to me? To me, therapy boils down to really one very simple thing. Do I feel like I can talk to this person openly? Do I feel like they can listen to me and understand? If you don't have that, you don't have therapy. And that really is the key. Talking to someone and feeling like you can open up to someone who will listen and help reflect on what you're going through is whatever model of therapy you use, cognitive, emotional, it doesn't really matter. That's the core of it. And you have to find someone you feel like will listen and understand.
It's a great resource sitting out there in the toolbox, unfortunately unused a lot of the time.
Unused and needs to be used more. Big study, I want to just say one last thing, Todd. There was a big study. It was done in Sweden a few years back, 22,000 people. And it was a post-suicide attempt study where a group of people that attempted suicide and a group of people who didn't were followed for 20 years. And 5,000 people who had made suicide attempts were followed, and the rest that had not were followed. The people who hadn't made suicide attempts were in therapy. And the people who were in therapy not only had much reduced suicide attempts, much reduced depression, much reduced anxiety, their health was better. They had fewer heart attacks. They had fewer visits to physicians. They had fewer health concerns. So the role of therapy that reduces stress has a powerful impact on you psychophysiologically, your whole body, not just your brain.
Yeah, it shows us what stress does to us a lot, too. All right, Dr. Ralph May, thanks so much for coming in, spending some time with us.
Anytime, Todd.
We appreciate it so very, very much. All right, that's going to take us right up to the mark.